Where is that good, amazing formula that you have to share with those mothers?
5 minutes. Read something. Drink your coffee. Do some meditation. Do something that makes you positive and enjoying what you are doing. So that's the main important thing.
And you are looking for a job in Dubai. How did you start? How did you go about it? How did you prepare for finding a job in Dubai? Because others might be looking for jobs and they would want to learn from you.
A training program. This is very important to get a very good training program so you know more about the skills, the surgery, to get through the
From accredited institutes, not online institutes.
Of course. How online? But I just have a little advice, because many people, they will go for interview, for example, and then they will get rejection. It doesn't mean that to be negative. It means that you just need to improve this point.
And I know that preparing for DHA exam is not an easy thing.
And as I mentioned to you, I don't want people to rush for the exam. Take your time.
Yeah.
You need to be more confident, because you will work here. You will have responsibilities.
Dr. Nanis Soltan, thank you very, very much for taking the time to come and be with us today. It's a Sunday. You already are very busy, like 7 days a week. You have 3 boys. Actually, you have 4 boys, the husband and your 3 sons, correct?
Yeah, 3 boys and my husband.
Okay, so you have 4 boys. Okay. So you left the 4 boys at home to be with us today, and this is like a privilege for us. Thank you very much.
Thank you. It's really nice being with you today, Wagida.
I would like to start by knowing a little bit about Nanis, the ophthalmologist in Dubai. Okay. Why ophthalmologist?
Okay. So I am coming from a family with a medical background. So my dad was an ophthalmologist. Seeing him every day, treating patients, preserving vision, improving vision as well, his kindness, his passion, that's all inspired me to be an ophthalmologist. Even after he passed away, it's honoring. Thank you. I'm honoring his legacy by following his path.
Actually, you are. You are. Not just because you are one of the most successful ophthalmologists that are in the UAE, and working with Dr. Gauba as well, okay, where I knew you from Imperial Healthcare, but because you knew how to bring in the balance between being that success as an ophthalmologist and, dare I say, an oculoplastic surgeon, to be an amazing mother as well and an amazing wife. Like you wear so many hats, but you decided to, Dr. Nanis, you decided to come to Dubai, correct?
Yes.
So what made you make the decision to come to Dubai, and how did you pursue? Was it a dream to come to Dubai, or did you come for other reasons?
It was a dream, yes, but my husband, he's the one who came first. And as I believe that the family should stay together, so I followed him. I got my license, and I need to get that chance also, because you mentioned the balance, to thank the 2 most important people in my life, my mother and my husband, for really, really supporting me during the journey. So after following him, I got my license, and then that time I started searching for a job, and I was lucky enough to work with Dr. Vinod Gauba, as you mentioned, and with the amazing team of Imperial Healthcare.
Yeah, they are amazing people, amazing team. So the reason I ask the question is because I know that you also hold your own practice in Egypt, in Cairo, and this is where I wanted to know brought you into Dubai? And the question here is for all the viewers that are watching you talk today, and they want to walk in your footsteps and become successful ophthalmologists, male or female, it does not really matter. What matters is you have an objective, you have a target. It's not called a dream, it's an objective that you do whatever it takes to get to that objective. So you came to Dubai to reunite the family, your family,
Yeah.
and you decided that you will continue doing what your dad used to do by helping people retain their eyesight, which I believe is, I'm not going to say, actually,
A big responsibility.
yeah,
Yeah.
and many researches were done to investigate the importance of all the importance of the senses that we have, and they realized that the sense of eyesight actually happened to be the top. Okay, not that the rest are not important, but eyesight, because the eyes can see so many things that other senses cannot. And with this, I want to know, I really want to know, how do you bring in the balance? Work-life, I will not say work-life balance. I will say you are a wife and you are a mother to three. One of them is a big boy. You're the only female with four boys. And I was with you this last week, last Eid al-Adha. The second day was Waqfat Arafat. And I wanted to tell you, okay, you have a good sleep. And you said, no, Wagida, I'm coming tomorrow because I have patients that are coming to see me.
Yeah.
Nanis, how did your family take it that all the other mothers are with the kids and your husband knows that the other wives are with the husbands, and you had to go to the clinic to see the other patients? How do you manage this?
They really understand. I know that my children, like one of them is 14 and I have a twins, they are 8 years old. But
Mashallah.
from the beginning, they understood that my mom has work, she's taking care of the patient, her work is important, family also are important, and there is a balance between that. So I appreciate how they understand this. I appreciate also that my husband, my backbone, of course, he's also supportive a lot
On the
in.
same page with you.
Yeah, he's also a doctor. He's a neonatologist, so it's kind of tough job as well. So
Dare I say tougher job? He can have more than one angry parent.
yeah, but it's a kind of balance, as you mentioned, and when they all support that, it's, I would not say easy because it will never be easy to leave them, and yeah, they want to go out there seeing other kids, and yeah, but still they can understand and they're really good in that, mashallah.
Alhamdulillah, and they
Alhamdulillah.
appreciate what you do.
Yes.
Okay, because I also know that you do work long hours. I come to the clinic sometimes to see you, and you do receive me until like really late evening, and you're there until you finish my consultation and everything. And when you sit with me, we have to do 1, 2, 3, 4, 5, and then you let me go, and I'm like, okay, I left, and she's still in the clinic. All right, no, I gotta run home. Okay, so I feel for you, and I needed to know because I know of some mothers that graduated from medicine schools and they graduated as doctors, and unfortunately they were like, we had to leave the practice because the kids and the husband's not accepting, and the kids are demanding, and I'm like, where is that good, amazing formula that you have to share with those mothers?
Let me tell you, it's always, of course, from Allah. Um, the support from the family, my husband, my mother, my children as well. And you should know that not all the days are good. There's some days good, some bad, some ups and downs in everyone's life. So you have to deal with that. What I usually try to make, which I noticed recently that is very important, is just to take a little bit, like 5 minutes for yourself in a day. Just, like a small me time. I'm not telling like to take 3, 4 hours. Nobody have that luxury to do it in this very fast life. But at least 5 minutes, read something, drink your coffee, do some meditation, do something that makes you positive and enjoying what you are doing. So that's the main important thing.
Take 5 minutes a day of me time.
Yes.
And this should work wonders.
I'm telling
Is
you,
this a
there is
promise?
some days up
Is this
and
a
down.
promise?
You have to accept that.
Okay, I do believe also it is the support and the understanding of the spouse,
Yes.
not just the kids, because without the support of the spouse, the kids
Of course.
yeah. They
Yeah.
they will go with the opposite direction of whoever, is being the angry one. We're gonna go with the angry one because we're the angry ones, angry birds.
Yeah.
Um, you left Egypt and you came to Dubai and you started working in Dubai.
Yes.
And you have faced new culture, you faced new clients, new people, new languages,
Of
new
course.
understanding and background.
Yes, and good that you spot that new language part because I really saw like some posts on Facebook, like I'm not able to work because I still don't have good English or I still cannot communicate properly. No, I encourage everyone, go search for a job. I'll tell you something, maybe it will be funny. I used to listen to videos on the YouTube to improve my English. I used to see movies in English. You know something, I have a small notebook. I used to write the sentence which I need to use in my future or on my communication.
Yes.
That was very important.
Yeah.
So day by day you will improve.
Yeah.
Yeah. So don't be scared from different culture or different language. What you will gain as a knowledge or as an experience on your life with dealing with different cultures is very important. You cannot ignore that.
So dealing with different languages and different cultures were some of the changes that you had to come in terms with. What are the other changes that you were not prepared for, but you realized that I have to face the music and I have to deal with this? I don't want to say challenges, okay, because a change is a change, whether it's good or bad, it's a change. It's something that comes to you and tells you that you have to change. What other changes that you encountered as an ophthalmologist and an eye surgeon in Dubai that you did not see in Egypt?
I would not say I didn't see in Egypt, but I see like it is more. So I saw before, but here it's more. The competition. The competition is high here. And
It is.
you know something,
It is.
in Egypt, for example, there is a title ophthalmologist. Yeah. Nowadays, this title does not exist anymore. You have to get a subspecialty. Means ophthalmologist, but you are a retinal specialist. Ophthalmologist, but you are work as a pediatric ophthalmologist. Ophthalmologist, but you are a refractive surgeon. Ophthalmologist, but you are
Which is what you
oculoplastic.
are.
Which is
You
very
are.
important nowadays. And I think it's not only in ophthalmology, it's in all medical fields. So nowadays, the subspecialty is very important.
So subspecialty, that would come from in-depth studying in that specialty that you are going to
Yes.
specialize in.
Yeah, of course.
Uh, so basically this gets me to how did you prepare for looking for a job? How did you look for a job? Where did you start from? Your husband was here already.
Yes, he was
Okay,
here.
but I would like to tackle it from the point of view that you are an ophthalmologist in Egypt and you are looking for a job in Dubai. How did you start? How did you go about it? How did you prepare for finding a job in Dubai? Because others might be looking for jobs and they would want to learn from you because you've done it.
Yeah. So I will start a little bit earlier. So first, the medical degree from a recognized university. This is very important. And then after the medical degree, the postgraduate degree means the specialty degree, for example, ophthalmology.
Yeah.
And the training program. This is very important to get a very good training program so you know more about the skills, the surgery, to get through the
From
clinical
accredited
case.
institutes, not online institutes.
Of course. How online? I'm seeing some ads like that.
That's why I had to bring this in.
Yeah, and then after all of that, you have to prepare yourself for the medical license here in Dubai. Because no matter how good is your CV, without medical license, definitely you can't practice. So you need to prepare yourself, study well, stay updated with all the guidelines, read from trusted online resources, and that become very easy nowadays to find a book online or whatever. Before, you used to go to the library, used to check. Nowadays, it's common and easy. Attend more conferences to stay updated. Study groups. Study groups are very important.
Yeah.
Yeah.
Yes.
So you can have
Especially
more
in
discussion.
research. Yes.
Yeah.
Yeah.
And then once you feel confident, don't rush to get the license. Once you feel confident, then go ahead with the process of the license and the exam and yeah.
So, okay. So coming here, you had to be prepared, correct? And then you need to look for a job. How did you look for the job?
I was lucky enough, as I told you, to work with Dr. Vinod Goba in
Yes.
Imperial Healthcare.
Yes.
But I just have a little advice because many people, they will go for interview, for example, and then they will get rejection. That doesn't mean that to be negative. It means that you just need to improve this point. You need to read more about this. You need to stay updated about this point. And then go ahead, do another interview, apply here, apply there, and then until you get the right fit.
How many interviews did you have, and how many
Not that
you were
much, to
rejected?
be honest. And yeah, I think that was my second one with Imperial Healthcare.
Okay, so the first one went well or not?
It went well, but the problem was the distance. I still was new to Dubai, so
Of course.
yeah.
Of course. Of course. Okay, let's talk to the one part that I know is quite difficult because I used to work for a home healthcare company and I know that preparing for DHA exam is not an easy thing. And this is the licensing party, this is the authority that will give the license to doctors and nurses and anyone from the medical field.
Yeah.
How did you prepare for the exam? And how did you get yourself registered so that, again, people will note down what you're talking about? They can do the same.
You have to read a lot. You have to study. Again, with the clinical experience, because I was, that time when I was preparing for the exam, I was still working in Egypt. So day by day, I'm seeing cases, I'm doing surgeries.
Of course.
Yeah, so that's very important. And as I mentioned to you, I don't want people to rush for the exam. Take your time.
Yeah.
You need to be more confident because you will work here. You will have responsibilities. So it's not easy. Just I finished, for example, 3 years of postgraduate, then I want to go ahead directly with the exam. Study, stay updated, all the guidelines, that's all very important. Attend conferences, that also will help a lot. And especially nowadays also for conferences, there is a lot of webinars. They are doing
Yeah,
it
yeah, yeah.
online. So
Yes.
it's good to
Yeah.
have like lectures online.
Yeah. I have a question here that is very, very important. Do you believe that someone who's been sitting home away from being in the practice every day like yourself, is it easy to have a comeback? Like 1 or 2 years, I'm out, maybe more. Is it an easy thing to come back? And please be very honest about it.
I don't think it will be easy, but it's not impossible.
It's doable?
It's not impossible.
All
They
right.
can do it, but they need family support. Especially, I know that the question is more related to women, because no man will have this.
No, it's
Yeah.
women that will leave
It's
everything behind them to
women,
stay at
after
home
having
with.
kids, and yeah. So, as a, it's not easy, but it's possible.
Okay, come back and update yourself
Of
and
course, and
re-practice and
yeah, and
start from scratch.
repractice and start fellowship or training program, and yeah, of course.
Are there any special certifications or degrees that you would advise ophthalmologists to pursue in order to have more job opportunities outside the borders of Egypt? Doesn't have to be
They will need the
Dubai.
master degree, of course, at least the master
Yeah,
degree
this
from
is. I
Egypt.
think this is the basic now.
Yeah,
It's
this
not
is the
bachelor's
most
degree
important
anymore.
one, and the training program, because master degree is an academic certificate. So without training program, it's
It's a certificate.
Oh,
Yeah, it's more theoretical than it is
exactly.
practical.
Yeah.
Understood. Now let's talk about the culture conflicts.
Yeah.
Let's talk about we used to do in Egypt, and other people coming to you and they say we do this in our country. I'm quite confident that this brings humor into your life every day.
Yeah.
Would you like to share some of the nice traditions that people come to you with and say, this is tradition, we do this in our country and it's perfectly fine?
There are some actually, not, like for example, cucumber slice, rose water on top of the eye, some remedies,
Yeah.
They are okay to refresh the eye.
Yes.
But they will never treat real problem. So some people, they do believe like, no, I have heavy lids, I will use cucumber slice. It will not treat the problem. It's just like
Bags under the eyes. They will go with tea bags,
tea bags,
cold from the
rose
fridge,
water.
and and roll a spoon, metal spoon or stainless steel spoon. Get it from the freezer and just roll it, and it will fade the bags.
Yeah. It will not treat anything.
Even
This
if
will
it's
just
fat
refresh the area.
deposits,
That's
it
it.
will remove the fat
Yeah.
deposits. Okay, what is your take on the black coal, which is also called kajal in some cultures? What's your take on babies born that they apply black coal in their waterline because it makes the eyes bigger?
Big no. I saw inflammation, very bad inflammation after this, because it went inside the eye. It's a baby, can rub the eyes. It went inside, it caused inflammation and corneal ulcer, and it doesn't make the eye big by the end.
But the worst part, actually, Dr. Nanis, is the fact that it's still done until today.
Yeah.
It's people are still doing it until today. You put it in the eyes because it makes the eyes bigger. I don't know how they do it, but should I say we need to request them not to do it?
Of course.
Please
We
stop
should
it.
raise awareness.
Please
about
stop it.
that. Yeah.
How about adults? How about ladies that apply, I forgot the name again, gel
Gel
eyeliner,
liner, yeah.
okay, and eyeliner, any colored pencil, applying it in their eyes like every day, and sometimes they
In the
they
water
apply
line.
it in the waterline. They apply it 3-4 times in order to have the definition all the time. And we, of course, we go home and we're tired. We're just going to clean the outside of the eye, but the inside of the eye is gonna
They
clean
don't care.
itself. The tears, is gonna that film is gonna clean the eye from the inside.
One of the most common problem due to this is the oil gland blockage and severe dryness. And this is a basic problem.
What does it lead to?
Yeah, so they will end up with very dry eye. The oil glands are blocked because of sleeping with the makeup, putting on in the waterline, and that's also the simple one. Recently, I came across cases who do have makeup deposits under the conjunctiva, the transparent layer, and that we cannot take it out
Wait,
and
the
cause recurrent
transparent layer
inflammation.
of the eye, they have it
Inside, from the lid inside. So I'm even showing it to the patient, like black dots are there. Patient will tell me, remove it. Sorry, I can't remove it. It's under the layer, and it causes recurrent inflammation. They think it's just on top.
So it goes in and is not removed, is not treatable.
We can, but it will still cause inflammation.
So, okay, do we say stop it or use it wisely and clean thoroughly?
First, don't sleep with it at all. Second, no need to put it on the waterline, just under the lash. It will look okay also. Leave the waterline as it is.
Leave the waterline alone.
Yeah.
Okay, let's talk to the lashes. You said lashes.
Yeah, extensions.
Yeah. Okay, it's like I like the idea very much. It's for some ladies, like they have they're not privileged with good lashes. And for a female, lashes are one of the most feminine features in the face. So unfortunately, with the social media, so many today, with, of course, the many offers and the pricing that goes down of the lashes, especially the ones that are sold online for like 7 dirhams and 8 dirhams, and the glue is like 4 dirhams. What is your take on artificial lashes? Is it good or bad? Do we stop it as female, or do we take precautions?
This I cannot tell, take precaution. This, it has to be stopped. The glues, again, can cause inflammation, can close the meibomian gland, and can cause dryness, can cause inflammation of the lid, and make the lid swelling, cause something called blepharitis. So my advice, if it is necessary to have something, then if you compare lashes with mascara, then definitely mascara is better.
So go with the mascara and leave the lashes alone.
But clean it well again before sleep.
Of course,
Yeah.
of course, of course. Anything you need to clean it well, the lashes, the
Yeah.
waterline, the face, the skin, everything. Which takes me to the inside of the eyes.
Mm-hmm.
You know what I'm going to talk about?
Expecting.
People's obsession with. Okay, I don't wanna be against anyone who thinks that colored eyes are a privilege. They are a privilege, but because it's a privilege means that not everyone's got it. Everyone's born with it. Mm-hmm. However, vanity insanity today has got to the extent that people go for surgeries to block the melanin production in their eyes, to change the eye color. And guess what? I've seen it on on Instagram. If you want it blue, we'll give you blue. If you want it hazel, we'll give you hazel. If you want it green, we'll give you green. And then when I looked carefully of the before and after, you can see that their eyes end up looking like vampires. Okay? But I know that this is not something good at all. Can we discuss the color change?
Okay, let me give you a brief about what is happening exactly during this color changing
Yes,
procedure.
please. Please
Okay,
explain it
so
to the
at least the
viewers.
audience, they will understand.
Please.
There are three types of procedure, okay? The first one is called keratopigmentation. Keratopigmentation, it's like a tattoo injected inside the cornea. And that procedure initially, it was not meant for color changing. It was for blind eyes, which looks white just for cosmetic appearance. So when they
To make
start
them
to
look
do it,
normal.
yeah, exactly. It was just to help them to look cosmetically better. That's it. And then they start to use it to for color changing. So this is the first one. This one can end up corneal inflammation, infection, ulceration, and then corneal opacity as well. The second one is an iris implant. So that's a surgery. They will open the eye and then they will implant another iris which have different color, okay? And with this one, you might end up high eye pressure and glaucoma and loss of vision because it's blocking the angle where the fluid should go through.
So you might end up blind.
Yeah. The last one, I think this is the one maybe you are talking
I've seen
about,
a
the
lot.
laser
The
one.
laser one.
The laser one cannot bring colors. It's just to make the dark brown eyes light brown or hazel. What they are doing is they are doing a deep pigmentation with a laser. So they are shooting the colored part, the iris, to reduce the pigments inside. Imagine what? You are shooting the iris, the pigments are dispersed, they are everywhere in
Scattered.
the eye,
Yeah.
and they can cause inflammation, they can block the angle, and they can raise the eye pressure as well. So that's why I want to simply explain the three procedures so any one of the audience who are planning or thinking about it should understand what is happening.
So basically, again, we're talking about something that can cause blindness.
Yes.
Because I have seen it actually on Instagram that some cases ended up with absolute blindness,
Yes.
and they were reported. And I've seen
The
some
three
doctors.
techniques are very dangerous.
Do you think the health authorities in the countries where these procedures are being performed should stop it?
Here in Dubai, actually, the EMA and the Ophthalmology Society, they already raised an awareness that it's not allowed here. And that's
Thank
very
God
good.
for that.
Yeah.
Thank God for that. So Dubai took the lead on protecting people from getting blind.
Yeah, not only in Dubai, even in the whole UAE.
In the entire UAE.
Yes.
There you go. There you go. Here is on. I hope more to follow. I certainly hope more to follow. In countries where they don't allow people to make money at some other people's expenses. Speaking of, sorry, but I have to go back to the lashes.
Okay.
Because it brought me, the eye color and changing of the eye color brought me back to something again I read about multiple times. And these are in some researches that they were done pertaining to using certain eyelash growth serums. And they had something that changed the color of the iris. Like for some people, they had blue eyes or green eyes or really light colors. And whatever they were using on the lashes caused the change of that color. What is it? What's happening?
Okay.
How bad a serum can be?
Let's go back from where we got the idea that there is a certain product will make the lashes longer.
Yeah.
There was an eye drop for eye pressure contain active ingredient called prostaglandin analogs.
Okay.
They noticed that the people who are using this drop for lowering the eye pressure, they are getting longer lashes. So initially, it was a side effect from the drops.
What a lovely side effect.
Yeah.
Okay.
So some cosmetic companies or even some people start to use the drop without any prescription, without having an eye pressure issue, just to make the lashes longer.
Okay, so they're using the eye drops that is
Which meant to be used
responsible
for-
for maintaining, or sorry, for lowering the eye pressure to grow the lashes, regardless of how this is going to impact the eye pressure.
It will not only impact the eye pressure, so
The
it will let the
eyesight?
lashes, there is another cosmetic side effect. It will let the lashes grow, but the area around the eye will be darker, and the eye will be inflamed, and they will feel like a sandy sensation inside the eye. So it has a multiple side effect. You cannot use something which meant to be for the eye pressure just to get your lashes longer.
Okay. It's like so far everything that I'm telling you to make eyes look nicer and bigger and better is it's dreadful to use on the eyes, but is there any ingredient or any herb or anything that you would say use this safely on the line of the eyelash growth in order to grow lashes?
Just keep the lashes healthy. You know, like
How?
you are taking care, for example, for your body, good hydration. Don't rub your eyes. You might lose the lashes while rubbing. If you have any inflammation, visit the doctor. So it's just a kind of some habits will make the eyelashes healthy, and then it will grow.
And dare I say the excessive use of mascara as well, and the aggressive way of
removing.
cleaning the lashes, that could contribute to losing the lashes
Of
too.
course, yeah.
So, what's your take on eyelash transplant?
Uh, no, again, no. I don't recommend this because the lashes have a certain direction. It's not an eyebrow transplant. So, for example, if someone done eyebrow transplant, wherever the direction of the lash up and down, it's okay. They can cut it, they can trim it.
Yeah, yeah, it
But the
grows like
lashes
the hair.
have certain direction. You cannot do a transplant, then you ended up with lashing, poking the eye. And that's another problem.
One more thing that just came to my mind when you said about the eyebrows transplant. With the eyebrows, it's already, the hairs are thick, and no matter how you trim them, okay, they will blend. We can put gel on them to trim them. But with the lashes, the tip of the lash is already pointy.
Exactly.
When you cut, that pointy end is no longer there. It will be the round of, the same shape of the strand of the graft of the hair. So you will end up with lashes that look with monstrosity.
Not natural, yeah.
It will look odd. It will look very, very odd. And the only solution might be to actually pluck them one by one, because you're not happy, and you'll end up removing your own lashes with this. Aside from the fact that I believe putting them, I don't know if the eye, the lash growth line has follicles, because I know that we have the
Yeah,
follicle. So you might end up with folliculitis in the eye.
Yeah. So I don't know. People are looking for all the cosmetic things around the eye without thinking about the side effects.
Vanity, insanity,
And
but
with a
thanks.
very sensitive area, very sensitive skin.
It's beyond sensitive. It's, as I said, it's it's the era of social media.
Yeah.
And
absolutely.
you said competition, and I would say it's also competition here. It's social media is making it an ongoing competition for who's who's got the prettiest eyes and who's got the longest lashes and who's got the nicest skin and who's got this and who's got that. But what I would say as Wagida is like play with anything but not with the eye. Like do whatever you want to do but not the eyes. And have you ever encountered people coming to you saying that my grandma still has cataract despite the fact that we've been using the eye drops to treat her cataract?
Yeah.
Can you please explain this part of the cataract and the eye drops that
Yeah.
eliminate
The
and
cataract
treat?
will never be treated with eye drops. Once it develops, it needs a procedure.
What is cataract?
It's a hazy lens. The natural lens inside the eye become hazy and unable to focus for reading also. So initially, for person who never wear glasses before, they will start something called presbyopia. Presbyopia means that the reading start to be affected. So they will start put the book here, and then here, and then here, and then put reading glasses, and then the natural process will keep progressing till they develop the cataract. And that time, once the cataract develop, it has to be treated with a procedure. It never will go with drops.
Is it something that develops with age only, or it could be an early medical condition for someone, like some of the other
There are
diseases?
some link with medical condition. There is also a strong link with UV light. So UV light can accelerate the cataract as well. So that's also mandatory to have a good sunglasses with a UV protection, because the UV can affect cataract, can affect, of course, dry eyes, and can affect the macula, the retina, the back part of the eye.
Yeah, and it affects the vision sometimes, even when I'm driving. If I'm not wearing like a very, very good lens in my sunglasses, the sun comes with a certain angle that I lose vision completely. Like you lose sight of where you're going because of the strength of the sun. It's not just here, it's in any country, including countries like Europe or the States, name it. But the objective of all of this is to protect the eyes.
Yes.
Just protect the eyes. Look after your eyes. And we're not referring to sunglasses that are like 10 dirhams and 15 dirhams. We're talking about lenses that are designed to protect you from the UV
As
light.
if, yeah, it have a UV protection,
Yeah.
that's fine. Despite what is the brand, it's okay.
Dr. Nanis, how can I convince my child, who happened to be a teenager that's going to university next year? Okay, so he's a big boy. To look after his eyesight by accepting the fact that he's got to continue wearing eyeglasses because unfortunately, as per yourself and Professor Dr. Gauba, you said that for anything procedure, we will not touch his eyes before he is 26 or 27 years of age, where everything is stabilized.
Yeah.
Okay, he is at the stage of, eyeglasses make him look nerdy. So, are there any other alternatives to eyeglasses? If not, what are the ramifications that my son or any other boy who's meant to be wearing eyeglasses to treat short eyesight and astigmatism, what could be the long-term negative impact if this is not looked after by the parents today that are suffering like me?
Okay. So let me tell you, as an ophthalmologist
Yes.
and as a mother.
Yes, please. Yes,
Because
please.
also my two boys, they are wearing glasses, okay? Well, the two of my boys. So as an ophthalmologist, they should wear the glasses. And when it comes and linked to astigmatism, there is a strong relation between astigmatism increase and rubbing the eye. So we have to monitor the children if they are rubbing their eyes. If you notice that they are continuously rubbing, you have to visit the doctor. So if they do have allergies, it has to be treated, okay? The checkup, the regular checkup to check if there is any increase in the power is very important.
Okay.
Because once they got increase in the power, they have to update the glasses.
Of course.
And most of them, when you give the new pairs of glasses,
Yeah.
they will tell, no, we need the old one.
Of course.
Yeah.
Because they take time to adjust.
Yeah.
Yeah,
This
I
is
used
a
to be
part
one of
as a
them.
mother.
I used to be one of them. Okay.
Okay.
Yeah.
So as a mother, I should monitor them. One also thing very important are the devices and lack of the outdoor activity. So if they have short-sighted and they are continuously using the devices, that also will make it progress. So they should have some outdoor activities. Encourage the children to do sports, to visit another friends, go for swimming, do something which is not linked to devices and screens.
Okay, I don't see this being very feasible for at least myself with a few other mothers that I know of, because we don't have extended families in Dubai. Like, I have my nephew here, but he's busy all the time. He works late hours. But Oliver doesn't have like his cousins here with us. So, and the other children as well, you know, they have their own.
Then sports. Sports are very important. You cannot ignore the sports and just let them stay home, and then I know they will stay home, they will stay on the device. There is nothing else to do. So the sports are very important.
Okay, sports indeed. Definitely, it's something really good to get them out and get them to do something away from devices. Speaking of eye dryness, my boy is 17, and he's on the devices all the time. For me as Wagida, I know that I can use the eye drops. I have like several types of eye drops. I know which one to use when. Can I use moisturizing eye drops on my son?
He has to be checked first. Not all the drops are suitable for the children.
Okay.
So he has to be, it cannot, for children specifically, you cannot get over the counter drops. They have to check what is the cause of dryness. Is it evaporation? Is it because of blue light?
He doesn't have dryness, but he's on devices all the time. So it's
so
for
it's
me
just
trying
an
to
advice
preventative measure.
Oh, okay, like a prophylactic? No, I don't recommend this. I just recommend to have frequent breaks from the devices.
Okay,
Drink plenty of water.
this is happening already.
Okay.
Sure.
And try as can as possible, since he's wearing glasses also, don't...
Since I'm trying to get him to wear glasses,
Yeah.
to wear his glasses. Yes,
Yeah,
yes.
because especially if they have even short-sighted or astigmatism, they will squint their eyes like that to see.
He does that.
Yeah, so that also make the eye strains.
He does that, and not just that. It gives him a lot of headache
course.
in school, because he sits in the front and he's still doing squinting to read what's on the board.
He's trying to use the muscles of the eye
As he
to
zoom
zoom
length.
more.
Yeah.
And that's make the eye more tired. You will end up with straining, headache,
Yeah, he does that. Mom, I've got a headache. He's got to go to the nurse, and the nurse has got to administer medication on him just because of something that could be all avoided with the eyeglasses. But I'm quite confident that there are parents as well that suffer from the fact that their kids are not buying the idea of wearing glasses. Now, speaking of replacing the eyeglasses with contact lens.
Not at this age, because they are quite active at this age. So what will happen? They will do sports, for example.
Swimming.
Swimming is not allowed at all with the contact lens.
So it's a no-no.
No, normal glasses. And I think nowadays also I can see that there are some optical shop doing a powered swimming goggle.
They do.
Yeah, and that's
Yes.
very good. Yeah.
Yes. Yeah.
So that helped, but
Yeah.
absolutely, has to be avoided, the contact lens for the swimming. We saw people lost their eyes because of infection from the swimming pool while they were in contact lens.
Oh dear. This really happened?
Yeah.
Okay, because for me, when you spoke about it, the worst case scenario was to, like, they will cost a good amount of money, and it's like while they're swimming, they open the eye, and then you lose the lens. I didn't know that this can actually happen when they're like diving or swimming with their contact lens.
Yeah.
Okay, so not recommended. Stick to
Stick
glasses.
to the powered goggles, yeah,
Okay.
and while swimming and the glasses.
Yeah.
Yeah.
Yeah. Definitely.
And
So-
then once they reach the age for the vision correction procedure, that time they can check for that.
We live in the world of AC everywhere in any country. Like we travel, we're here, we go to Thailand, we go to Hong Kong, we go to Singapore, go to Malaysia. All of these places, we are going indoors most of the time, okay? And it's all AC everywhere. I'm not going to say this is good or bad. That is a very subjective question. My objective question here. Does this consistent exposure to AC cause more dryness? Like outdoors, I have the sun, indoors, I have the AC. Is like, what? Do I kill myself to just finish this dilemma?
See, the main problem with the AC that it makes everything dry, the whole environment dry. And the eyes that time will lose the tears through the evaporation. So the eyes also will be dry.
Okay.
So my recommendation is a humidifier that will help a lot with the AC, drinking enough water, because the problem that when you are in a good temperature, which is caused by the AC, you will forget to drink water, unlike that you are in a hot weather. So drinking enough water is mandatory. The humidifier also is very important.
Okay, so having a humidifier around is a good idea to hydrate.
Yes, of course.
Even around my son, yeah?
Yeah.
Okay. Now, what is your advice and what is your, I would say, motto of getting the tough going that you tell every day as a very busy ophthalmologist, as a mother of 3 boys and a wife to another doctor? Okay, and I'm quite confident the timing between the two of you might overlap at times, but you are talking now to many viewers, and I hate to say I'm targeting female because, as we said, the father or the husband is not going to leave his successful career as a doctor to stay at home, but the mother usually is the one to leave everything for the husband and the children.
Yeah.
So things, definitely, you said it yourself, some days are good, some days are bad. But some days will come and become really, really rough and tough on you, and I'm sure you grow tired.
Of course.
It's like tired physically, tired mentally, and emotionally. So what do you say to yourself to get this toughness in the inside of you to smoothen and soften and go away?
So there are 2 things I'm usually in my mind. The first one is you are progressing in your life and you are not perfect. You should believe that you are not perfect. And the second thing to improve or to encourage myself to do something is always one step at a time. You know the story of the perfect tomorrow? Ever heard about someone who will decide at the weekend that I will start from tomorrow, I will live healthy life, I will do
Heard this
sports,
so many
I will read a
times.
book,
Yeah, especially
I will
on
do
the
this and I will
31st of
do
December.
that.
Yeah.
And then it will never happen.
Yeah.
And if it happened for 1 day or 2 days,
That would be the 1st of January,
Yeah,
the following
the
year.
best
Yes,
scenario.
yeah.
No, I do believe one step at the time. For example, you want to improve yourself in terms of food. You want to eat healthy food. So start that I'll do, for example, intermittent fasting. I will eat this and that, and then continue. Then I want to add sport. Don't go to the gym and then train like 2 or 3 hours. Of course, you will never go back. Just 15 minutes walking, and then continue.
Okay.
And last, for example, I need to read a book. You will not read the whole book one day and you never read before. Just read one page. So I do believe one step at the time, by the end you will reach your goal.
So basically, eating an elephant one bite at a time.
Yeah.
Okay, I believe in this one thing. Eating an elephant is one bite at a time. And with this, I conclude this magnificent episode from Podcast with Wagiza Season 2. I don't want it to end, but unfortunately, the time has come to where I will say again, thank you very much for your time, for taking the time away from your 4 boys.
Thank you, Agida.
To be with us, and
It's
from
really
taking.
nice being with you.
Oh, thank you so much, Dr. Nanis. I will be putting the link to your direct page where you have your DM under the video and in all the reels that will come, so that the viewers will have direct access to come to you and ask you. And I'm not just talking about patients here, I am talking about
Anything. They're more than
ophthalmologists that want to become that successful and want to have tips and advices on how to go on with the career and become a successful ophthalmologist like Dr. Nanis Soltan.
Thank you so much.
Thank you very much.